Hello, my name is Dr. Jerry Morris, and I'm the Executive Director of the Academy of Medical Psychology. In this section, you will be able to access our application, and there are two forms of membership. There are those licensed psychologists and other licensed mental health professionals and students who are interested in the field of medical psychology and continued education and enlightenment and collaboration with medical psychologists. And then there's the application to become a specialist or to become board certified and a diplomat in medical psychology. In this section, you will see the application materials and the required support materials to file for candidacy in board certification in the specialty of medical psychology. Now, the criterion to become a medical psychologist include being licensed to provide psychology at the independent level in your state without supervision, and therefore having the capacity to diagnose and treat mental illness and the behavioral aspects of chronic medical diseases. In addition to that, you have to have postdoctorate training in psychopharmacology, in basic sciences, including psychophysiology, neuroanatomy, biochemistry, and a number of other subjects that are discussed in our website in the criteria. Once that training is completed, and you can get that training either through a postgraduate master's program in psychopharmacology or medical psychology, or you can get that training through continuing education programs that are approved by the board with the National Alliance of Professional Psychology Providers and the Academy of Medical Psychology through our website, Continuing Education and Mentoring System. Or if you've passed the Veritas exam and been trained in the continuing education program related to that, you may qualify also. The next step, once you've acquired your approximately 2 years of postgraduate didactic or matriculated graduate education, is to get a preceptorship, which is a residency in the diagnosis and treatment and either level 3 practice or prescribing psychotropic medications as one component of a medical psychology treatment plan, or functioning in a state where you can practice at the level 2 level, which is to diagnose and establish treatment plans and recommend to a licensed prescriber the psychotropic medications necessary to have a comprehensive treatment plan. Once that 1,500 hours and at least 100 patients under supervision of a board-certified medical psychologist or a licensed physician or licensed nurse practitioner is documented, then you may qualify to reach the candidacy status. Now, the candidacy status allows you to sit for both our oral exam and our written exam. Some people will substitute the American Psychological Association PEP examination for our written examination, or they will substitute the Veritas written examination, and that waives the necessity of them taking our written examination, but they must submit themselves to a 3 medical psychologist board examination with oral examination and specific essay questions related to cases and demonstrating competency in medical psychology. Now, during the normative period of our written exam, which will extend for several years, we are asking those who have taken those other exams to take our exam for normative purposes if they are willing to volunteer to do that.